if you can't, I am going to introduce you to cancer care. And I'm like, what's that? And you said cancer care. They also, I said, I know about cancer care, but I mean, do they take care of stuff like this for? And then you said, here's their card, call them. Before I left here, I did so. And immediately I got all the information I needed. And the next 10 days, I had to get, between my doctors and my oncologist, they had to sign one thing or the other. I got help from cancer care. Nobody does that, number one. As soon as I would have walked out the door, okay, that's another client gone. But we had connected. And not just me, I watched you ask the same question to other people that were here. How were you fortunate to have been connected to cancer care, to be able to give us that assistance?
It was, I had one young lady that came in with her sister. She was really, really young, and she was extremely upset. They were both upset at that time. And so we really were in the room. I got her laughing, and we were talking about the life, and her sister was really, you know, into making sure that, you know, her sister is comfortable enough and happy. And we were talking about cost of the prosthesis and dealing with insurance. And, you know, people, there's a lot of women that cannot afford. There's a lot of women that don't, like you said, you don't even know about it.
Yes.
And once her sister was leaving, I was telling her, I said, you're so lucky, because her sister purchased everything for her. Beautiful. She wanted her to have everything that she needed. And I was like, you're so fortunate enough to have somebody that's, you know, paying for you. And I said, there's a lot of women, sadly, these days that they cannot afford this, or they're having issues with insurance, or there's so many other things that, you know, we all go through. And she was like, wait a minute, let me help you out with this. So she goes like, I work for Cancer Care. Here is our card. We're a nonprofit organization. You make sure that no woman walks out of here being scared or get in trouble financially or fight with the insurance or whatever reason is not to have these items. We will help them out. You just give them the number. You make sure that, you know, they understand who we are, and we'll take care of the rest.
Wow.
I was so happy when I heard that.
Fantastic.
I was crying because I was like, now
I can help.
Now I can actually, you know, help, and for this, you know, for none of us to go through that.
Yes.
I mean, financially, I mean, you already went through so much.
Exactly.
And now just to, you know, to feel
that comfort.
That comfort, it's like now you're stuck because, I mean, they are pricey.
Yes, very pricey. Very.
I mean, bras are not as pricey, but prostheses are very pricey.
Very.
I still feel it's very pricey. And when she told me that, and few of my clients, they called me, and they were like, oh my God, they are unbelievable. And they have counseling, they have so many other programs. I am so grateful to this young lady. Obviously. I am so grateful to her because, I mean, I always say it was meant to be. It was meant for me to meet her. It was meant for me to be able now to send everybody if they
to
have
pay
a
it forward. She was paying it forward.
I was ecstatic when I heard that.
Yes.
And like I said, I'm gonna be thankful and grateful to her for the rest of my life.
Yes.
And they are amazing. Yeah. They are amazing, amazing.
They really were fantastic. You know, called me up to find out if everything was fine, and you know, so really, the blessings that she's going to get, not just from me, from so many other people that you have connected to cancer care. There should be more of that. She didn't have to.
She didn't have to, but
it was,
like I said, it was meant to be.
It was meant to be.
It was meant to be.
Yeah, that's great. So, you know, apart from us having fun and all that, apart from this, how do you unwind? Because this is a business that starts at about, we're taking up your time today, but yes, that's once in a blue moon. But I know by 10 o'clock this place is going to be full.
Yes.
So from 10 to about 9, you're on your feet.
10 to 8 for sure.
You have so much energy. I don't know where I'm still learning. I'm just still trying to see how I can get an eighth of your energy. How do you unwind after all this? Do you do any sports? Do you do any? What is it that keeps you?
I mean,
keeps that buzz.
We all have. I mean, I have tough days too, because when I have 5, 6 clients a day, and you hear from one sad story to another, it's tough on me too. It's like I have to be able to keep going
In the present.
in the present, yeah. And there's some days that I walk out of here and I'm so happy, and there's days that when I walk out of here, it's like, oh my God, it's like I'm just going home, and these beautiful women, what they have to go through and what they're facing tonight. So it does take a toll on you. What I like to do is usually, you can't say this too loud, can we?
Please feel free.
Usually I like to have, when I get home, I usually like to be on my deck. Doesn't matter if it's snowing, sunny, or whatever. And I like to sip my glass of red wine. Yes. I have to have that. That's like my medicine.
Yes, it is. But it is medicine.
It is medicine. And on the end of the week, I like to go on a Saturday or Sunday. I love to go to yoga. Meditation helps me get ready for the following week. And I like to have fun. I like to have a lot of fun. So, with my 2 adult sons and friends and family, there's always some kind of activities that goes on that it helps me, not to think about. Relax a little bit.
Relax.
So to be ready for Monday and then go Monday through Friday. Right. But usually it's like my little glass of red wine.
No, that is imperative. I mean,
yes.
Even the French say, just un pot de vin.
That's it. Just
that's
tiny
just
bit.
a
It's
little
like,
bit
and
of,
I sip and I take, and I never come home and go right to bed. I always take an hour to unwind.
So is that what keeps you on your toes? Because you have so much buzz, people skills, having to deal with so much going on. A lot of people can't handle it. So what's your secret actually to keep that smile on the face? It can't just be yoga and a glass of wine. What is it?
I just feel if you're doing something and you're so passionate about it, it's not a job anymore. It's not a job. For me, this is not a job. I come here and I feel like I meet women, I relate to them, make women happy, go out of here. I just think like this is my drive and this is what gives me energy. Like I said, when you walked that day and I was walking with you out, it was like I was bouncing more than you were.
You certainly were.
Having somebody come in and...
You transformed me. Just that transformation.
And for me, that gives me energy.
Yes, that is true.
So it's like as much as gives you, you bounced off to me.
Yes.
So we both walked out of here.
Exactly.
Bouncing.
Bouncing. Like I was asking you, I said, how is it that you can put smiles on our faces, with what you do? Because it's tough.
Yes.
You having to make sure that you see what we go through, and you're trying to avoid reminding us of what we've been through, trying to give us that, pep talk that we're still beautiful. It's all in the mind.
But you are.
And all that. Yeah, but having gone through all that, it's easy to say so. I know it's not easy for you because you've walked down that road, even though you haven't. You have people close to you. But for the 2 years that I was battling cancer, it was unimaginable. You wouldn't wish your worst enemy that, But we really do appreciate Fairy Godmother, what you go through. So tell us, if you were much younger now, if you were, what would a note to your younger self be if you had to write a letter to your younger self now? What is it that you would write to her?
I would tell her, I would probably write to her, don't ever give up. Just keep going, follow your heart. there's gonna be obstacles in your life, and just keep going forward.
Have you had any obstacles?
Oh boy,
A lot of them?
A lot of obstacles, but
It never deterred you because see,
No.
look at you now.
no,
You've done very well for yourself.
to me it's like you have to look forward. And to me, the best medicine is surround yourself with people. I love being around people. Like I told you. Are you sure you want to be talking to me? Because I can't stop.
Oh yes, please, we need you. We need you. Please come.
Remember we were laughing so much in the fitting room that everybody was coming and was like,
What's going on?
What's
You
going
know?
on in there?
Yes, and you really have the. You could have been in medicine and you would have done equally well because it's not just about medicine per se. It's the whole psychology about it, making people feel good about themselves afterwards, especially after such a very daunting experience, and bringing them back. Saying, listen, this is what has to be done. Like you say, keep moving forward and all that. It's strange because when I was going through my experience, I didn't want to be around anybody. And I was glad, I thought I was odd or, funny. But when I discussed with a lot of other women, they said, Grace, don't feel bad about that. There are a lot of people that needed to face or go through that experience alone. Other people would say, oh no, even if like you told me, you said, if I cut my finger, the whole world would know.
Yes.
And that was just a finger. But for something like what we have been through, we needed to internalize it and fight our battles and then come out stronger. Because for me, and I'm sure for the viewers and listeners, there's still a lot of us that after being hit with a diagnosis like that, you try to swallow it alone. Because if you have family or friends, I'm very emotional. I cry at the drop of a hat. I mean, I watch a movie, my daughter says, oh dear, here she goes. Should we get you a towel or something? But a lot of people also say, yeah, we don't need too much people around us when we're going through.
I mean, I remember with my daughter, when we were talking about it, and to me, I only knew about the hospitals, doctors. That was my world.
Yes.
I didn't know anything else, and pretty much I lived there. So I was not around. I was not out on the streets. I was not in the restaurants. I didn't communicate to so many people except doctors and nurses. So after she passed away, I felt like I had to learn how to live again, because, like you said, when you were talking and you said I wanted to be alone, and I kind of shut myself away from everybody. And I think everybody goes through that. Like, you have to go through that period. It's stages of recovery. And for me was getting one person to talk to me and to get me, like I said, into group therapy. Because for me I felt, like you said, you felt everybody's looking at me. Everybody thinks I'm weird because I pretty much wasn't in the public for 3 years. Yeah. And how do I relate to people now, because nobody understands me? So everybody goes through stages. That's when I was talking to you, I was like, Grace, it's okay. You will get, look at you now. That's what you got.
Yeah, thanks to you.
Look where you are now.
Yes, that
So
is so
I mean,
true.
we all have to go through stages. I mean, you had to deal, like for me, I tried to understand, but again, I physically didn't go through. I mean, I had to be responsible for somebody else.
Exactly. So if you had to walk down this path again, would you still go down this path of lingerie? Would you probably go into medicine or nursing, because you're caring, you're a good listener? One could just put their troubles on your shoulders and you bear the troubles well. You're a good support system. Would you come down this road again, or would you go somewhere else?
I
take another path?
I think I would take this path. I think yeah.
Fantastic.
Yes, I would.
Because it gives you so
Yeah.
much fulfillment.
Yeah,
That is it. Yeah.
for sure.
And what about this place? What happens next? Are you going to sell it? I mean, is it going to be sold? I mean, is it going to be, what's going to happen? I mean, we hear of so many businesses,
Yes.
you know, lasting eons. What plans do you have in promoting its legacy for it to, you know, go on? It's already been here for how many years?
Almost 10 years. But Linda's been around for like 30 some years.
Wow. And do you see it going further, another 10 years?
Oh yes, for sure.
I believe
I'm
so
gonna
too.
make sure that it does.
I believe
I'm
so
gonna make
too.
sure that it does, because this is where I'm retiring
Yes,
from.
I believe so too.
And everybody said, I said, I'm gonna be the oldest woman ever retired in this country.
No way, they're older women, my dear. Wow.
Definitely, definitely.
Are you, what should I say? Do you have some, are you grooming, looking to groom some? I mean, there'll be sometimes you'll just want to go, maybe go to the mountains, go hang there and come down every month or every 3 months or something like that. At least just go
Yeah.
live your life up there. Do you have somebody that you see, or are you looking to kind of groom someone who has, you know, your DNA? Let's put it like that. Somebody has to have your DNA, that drive, that drive and everything
Yeah.
to continue this legacy that can do as well or even better.
Yeah.
We're looking for someone that would do better than you.
I mean, you see, Linda passed this on to me,
Yes.
so I succeeded her.
Yes.
So I'm definitely grooming somebody that has a drive that I see in her, and has a huge interest, loves to be around people, loves to help people. So hopefully she'll succeed me. That's my goal.
That's good.
That's my goal. I want this legacy to continue.
Right. And I wanted to find out what advice would you give, not just we women, anybody that is going through a very, very challenging time now? Because right now, as we speak, I have an uncle, a very dear uncle of mine, who is battling prostate cancer, and it's been tough. But what word of advice would you now give to anybody who's facing such a tough diagnosis as cancer? What would you say?
You have to have faith. You really, really have to have faith. And you have to believe in miracles too,
Yes,
because miracles do happen
all the time.
all the time. So to me is just hang in there. You'll be fine.
Yeah.
You'll be fine.
So, Angela, thank you so much for being with us and for finding the time. My darling sister joined at the hip. My fairy god sister. It was wonderful, and we're going to do it again.
Thank you
There'll be much more opportunities for this.
Thank you.
So, my dear audience and friends, there you have it. This is Grace Charrier signing out from the Cancer Convos. See you next time. Adios.